For my call to action paper, I chose to address the syphilis crisis in Colorado. This is by Loiswa Emma for Nursing 748, Healthcare Ethics, Law, and Policy by Dr. Susan Petrin. Syphilis is a sexually transmitted infection that can cause permanent damage to the body when left untreated. Cases of syphilis have more than tripled in Colorado from 2018 to 2023. In 2018, there were a total of 1,084 cases, as opposed to 2023, there were 3,266 cases of syphilis. Cases of congenital syphilis have also spiked more than 7 times in the same period, going from 7 cases in 2018 to 50 cases in 2023. Congenital syphilis symptoms include stillbirth, blindness, deafness, developmental delays, and bone abnormalities. Now, some children or some babies that are born with congenital syphilis may not show symptoms at birth, but they're still very likely to develop complications later in life. And congenital syphilis does cause a 40% chance of stillborn birth. Despite syphilis involving 4 stages of infection, the infection may present without symptoms and therefore easily be transmissible. A lot of people may not know they have the infection, and they may continue engaging in sexual activity that puts others at risk or spreads the infection. Stages of syphilis: the primary, secondary, latent, and tertiary. Primary and secondary are when the bacteria is more likely to be transmissible. Latent is when the body kind of gets used to the bacteria, and the patients don't develop symptoms, and they may not develop symptoms for years. And the last stage is tertiary stage. The tertiary stage can occur at the primary stage, secondary stage, or it can occur after the latent stage. And symptoms or side effects for these include autosyphilis, ocular syphilis, and neurosyphilis. And then if not treated, it can also lead to arthritis, heart disease, and blindness or death. Symptoms of neurosyphilis include severe headache, muscle weakness, change in balance of feeling and extremities, trouble focusing, confusion, personality change, or problems with memory, thinking, and decision making. Ocular syphilis causes eye pain and or redness and changes in vision or blindness. And autosyphilis causes hearing loss, ringing, buzzing, roaring, or hissing in the ears, and dizziness as well. So the symptoms of tertiary syphilis are quite severe, and they could impede daily activity. So it's ideal that the infection is treated before it reaches to that stage. Target audience. With the rates of congenital syphilis on the rise, efforts must be focused on the women's population and their providers. The rate of syphilis diagnosis increased by 177.2% in the period of 2018-2022, but the infection rate among females increased by 526.1%. That is a large number. It's also important to note that the highest rates of diagnosis were people aged 30 to 34, which is a young population. And especially considering for Colorado, there are quite a lot of young people in the state, and the median age is 37.7 years. If women know how to avoid and treat this infection, the percentage of congenital syphilis would greatly reduce. So the main targets will be the female population, the homeless, medical care providers, and the general public. The reason we're targeting the homeless as well is because data shows that syphilis and HIV are transmitted at a higher rate among the homeless population, with predictors of acquiring the disease including previous syphilis testing, which means they're infected previously and they may have been in the latent stage until symptoms reappeared, history of genital lesions, the use of illegal street drugs within the previous 6 months. The Colorado Coalition of Homelessness estimated that in 2022, the number of people experiencing homelessness in Colorado are between 10,000 and 53,000 people. Now, this number obviously changes because a lot of homeless people transition from state to state depending on the weather and resources that are available to them. Because the population of the homeless is so high, medical care providers for these at-risk populations including free clinics, urgent care centers, emergency rooms, outreach programs, advocacy programs, pregnancy counseling clinics, pediatric clinics, and any other facilities that are likely to come in contact with women, children, and homeless need to be particularly reached out to watch for symptoms and provide treatment to patients. Solutions to the problem. So, syphilis became a crisis in Colorado in April of this year. And the governor, Jared Polis, has already initiated several initiatives and policy changes to help combat the rise. The two big ones are the field delivery program, which delivers medications or prescriptions to patients, their partners, or both at home. And the program is geared towards assisting those at an increased risk of sexually transmitted infections, those that are uninsured, those that are underinsured, or unable to seek treatment in a timely fashion. The second big program is a Bicillin Access Program. Now, Bicillin is an IV antibiotic that is used to treat syphilis infection. And the program works in such a way that providers can request the Colorado Department of Public Health and Environment to provide Bicillin medication to the clinics free of charge, and therefore the provider's patients don't have to pay for the medication, but the provider does have the choice of billing for the services of administering the medication, but not the medication itself. But unfortunately, because we're in a crisis right now, there's a higher demand for the medication than there is a supply, and because of this, the CDC came up with a guideline program whereby it prioritizes pregnant women, to reduce the risk of congenital syphilis, and also prioritizes patients that have a history of noncompliance with oral medications. Hopefully they have enough supplies. There are some orders that are in backlog, but the CDC and the CDPHE are working really hard to try and address those. Now, Governor Polis did include these agencies listed here to assist with the crisis, and that's the Behavioral Health Administration, Department of Local Affairs, Department of Healthcare Policy and Financing, Department of Human Services, Department of Corrections, Department of Public Safety, Department of Regulatory Agencies. It's quite a comprehensive list of agencies that are involved in the situation. For example, the Department of Corrections, it is advised that once prisoners are admitted into the prison system, that they be tested for syphilis and HIV, just to kind of help with combating the spread of the disease. And also, Department of Human Services, it deals with cases from children to adults that are not in a safe environment. So they have a wide range of clientele. And Behavioral Health Administration, Public Safety, they kind of assist with the general aspects of dealing with the syphilis crisis. So for my call to action paper, I did not necessarily create a new healthcare policy altogether. I just came up with additions to the current policy in use that could improve the response of the state to the syphilis crisis. So I would suggest that to improve media involvement to spread information, the first time I heard about the syphilis crisis was when a professor mentioned it in class. And before then, I was completely unaware of this, and this was not too long ago. So as a doctorate student, I make it my business to try find out what is happening in my community. And for me, somebody that's actually interested in knowing what's happening, not to be able to know about the situation until I dug into it, that should not be the case. So I would encourage that the state involves more local news channels instead of just posting articles online that may or may not be read depending on who subscribes to the websites. They could also have little clips in the local news about, cases of syphilis are rising. Please be be cautious. These are the symptoms. Seek your medical care provider if you show these symptoms, something to that end. And also, social media platforms are very important. Anything from TikTok to Facebook to MySpace for those that still use, excuse me, MySpace. Social media can play a very important role in addressing the issues that are facing the state at this time. Another means of communication could be advertisements for testing on the internet. A lot of people are on their phones, playing games, surfing the internet, buying products. If the state could sponsor advertisements like they did during the COVID-19 pandemic, where it would just be a little bit saying there's an outbreak of syphilis, please beware, then more people would be aware of the situation. Data does show that almost every homeless person has a phone, 95% to be exact, and about 80% of those people have a smartphone. So if that high of a number of the homeless population who are financially unsecure can have a phone and a smartphone, then the state needs to use these channels more to reach not only the homeless people, the pregnant people, the vulnerable populations, but the general public as well. Another thing would be placing posters downtown and around shopping centers where people frequent, or they can just see on their way out, or they could use billboards temporarily, especially in downtown areas where there's a lot of homeless people that live or hang around those areas. Other suggested interventions would be expanding testing and treatment interventions, similar to those of the COVID-19 pandemic. During the COVID-19 pandemic, there were buses that would either pop up at the mall or places with high traffic, and that would administer the COVID-19 vaccination. So I would suggest that the state would do a similar thing, whereby instead of vaccinations, they would avail buses or trucks or pop-up centers that could provide testing and antibiotic treatment for those that have an obvious presentation of the infection. They could also advertise the locations to these buses in advance, like they did with COVID, where there's a notification that says it will be at this location at this day and this time. Please come out when you're interested. And I am sure that would lead to more people getting tested, more people getting treatment, because one of the barriers to receiving care is being able to make an appointment with a provider, be able to keep that appointment. But if they remove that barrier where somebody could just show up and get tested, get the results via the phone, then that would, I feel like that would really combat the situation much better than it is now. And for providing free testing and treatment, so far the treatment and testing is free for Coloradoans that are covered by the Medicaid insurance, and on low cost or copay free for most medically insured people. And the state could also sponsor people that do not have pre-established providers, and they would offer the test and the treatment at low fee or no cost. Barriers to implementing these additional policies and programs would include, obviously, cost. Despite all the agencies that are currently involved in combating the situation, there would still need to be an influx of funds to fund the buses, fund the staff, fund the lab kits, fund the testing centers, funding the notification means when results do come out, and then staff again to give treatment if the day of testing, the day of treatment are two different dates. And then another barrier would be the ever migrating homeless population. Just because somebody was tested in Colorado Springs doesn't mean that they will be available in 3 to 5 days once the results do come out. So that could be a barrier because they may not, homeless people don't necessarily always stay in one location. So it may be a barrier where a person is tested, they are positive, but then they move on and say they don't have symptoms. So to them, they're thinking, why bother? I'm not showing any symptoms. I'm fine. And then that would facilitate spread of the infection as well. Another barrier is that not all women receive prenatal care starting the first trimester. Um, Congenital syphilis can be treated, but it does need to be treated as soon as possible to reduce the chances of any side effects of the infection during birth and after birth. So the fact that not all women immediately receive prenatal care once they find out they're pregnant during the first 12 weeks, the first trimester, that could be a barrier as well. And here are my references.